The illusion of the knife. What if the surgery that changed your life never actually did anything at all? At the center of every hospital lies an unshakable belief that when we cut, we cure. That pain can be carved out. That illness can be fixed with a scalpel. But over the past 2 decades, this belief has come under fire, not from conspiracy theories, but from clinical data. Research is revealing something stunning. Some surgeries don't work because of what they do. They work because the patient believes in them. This is the strange, where the incisions are real, the pain is real, the recovery is real, but the treatment never happens. And yet, somehow, people still get better. If belief can heal, what does that say about the blade? The numbers that cut deeper. They went under the knife, but the knife never truly touched them, and they still healed. In 2002, a landmark trial led by J. Bruce Moseley at Baylor College of Medicine tested arthroscopic surgery for knee osteoarthritis. Patients were randomly assigned to either real procedures or a sham surgery with only small incisions and noises mimicking the operation. The results were shocking. All groups, real and fake, felt the same relief. The knife had not healed them. The idea of the knife had. This wasn't a fluke. In more than half of 53 major placebo surgery trials, fake surgeries worked just as well as real ones. Real surgeries only outperform placebos in 49% of cases, and only slightly. A 2022 review confirmed it. In many cases, especially on knees and spines, surgeries worked mostly because patients believed they would. The data doesn't lie, but it makes us question everything we thought we knew. Ritual, belief, and the brain's power. If the body follows the mind, then what is surgery, if not a ritual? How can a fake operation deliver real relief? The answer is buried deep in our biology. Surgery is more than science. It's performance. The anesthesia, the incision, the sterile lights, the recovery. It's a ritual, and rituals have power. When a patient believes they've been treated, the brain releases its own pharmacy endorphins, dopamine, anti-inflammatory chemicals. The relief isn't imagined. It's measured. It's real. Especially in conditions driven by pain where perception is reality, the placebo effect isn't a trick. It's a biological phenomenon. We are not pretending to heal. We are healing through belief. Maybe the most powerful scalpel is the mind itself. Ethics, illusions, and a call for truth. Here's the ethical wound we can't stitch shut. Are we cutting people when we don't have to? In 2018, a randomized trial in the Netherlands tested vertebroplasty for spinal fractures. One group received the real procedure. The other received a fake. After 12 months, both groups felt the same. Earlier, US studies found the same pattern: no real benefit to the actual procedure. From spinal fractures to knee operations, placebo surgeries often matched real ones in outcomes. Yet the risks, the cost, the recovery, all continue. This isn't about bad medicine. It's about facing an uncomfortable truth. Some of the most trusted treatments might be illusions we all believe in. Because sometimes it's not the cut that heals it. It's the story we tell ourselves while we're under the knife. Now, if belief can heal a wound, can it cause one? You see, the mind doesn't just heal the body. Most times, it is the thing causing the pain. And you don't need a surgeon or a scalpel or an operating table to feel it. It happens in the most ordinary moments. Imagine you're sitting at your desk, and then, out of nowhere, you taste something bitter in your mouth. There's a smell of cigarette smoke, sharp, acrid, but no one is around. Your stomach flips. Your skin itches like it's on fire. But it's not from your clothing, or from something you ate. There is no blood, no injury, but your body feels like it's under attack. You go to the doctor. They run tests. Nothing shows up because nothing is physically wrong. And yet, the symptoms are undeniable. Phantom sensations, digestive chaos, sensory overload. This is the hidden language of anxiety, the opposite of faith. It is here to damage, not to heal. It begins in the head and spreads to the flesh. What placebo surgeries show us is that belief can heal, but anxiety shows us that belief can also harm. The same brain that turns fake incisions into real relief can turn everyday stress into full body symptoms. Here is how it works. A thought becomes tension. Tension becomes discomfort. Discomfort becomes a physical sensation. And soon, the body is caught in a story the brain never meant to write. Smelling burnt toast when nothing is there? That is phantosmia, often tied to stress and sensory overload, not seizures. Crawling skin? That is the peripheral nervous system firing false alarms. Nausea? That is the gut-brain axis in distress, a feedback loop where emotional overload becomes digestive dysfunction. Even bright lights and sharp sounds? That is sensory sensitivity from a nervous system stuck on high alert. These symptoms are not made up. They are just misinterpreted. They are the body's way of saying something is wrong, but it is not where you are looking. In both placebo surgeries and anxiety cases, the brain leads and the body obeys. So maybe healing doesn't always begin with medicine. Maybe it begins with interrupting the story your body is acting out. Not by asking, what is wrong with me? But instead, what is my body responding to? If you enjoy content that informs, inspires, and digs deeper into the stories that matter, hit that subscribe button and stay connected with Zeal News Africa.